Topic Area 5 Diabetes Overview. Some of the food we eat is converted into glucose, which finds its way into our blood and gives us energy. Normally we release a hormone called insulin to control the levels of glucose in our bodies. If a person has diabetes, however, this process does not work and their levels of glucose cannot be controlled. There are two main types of diabetes, type 1 and type 2. In both types, glucose levels build up in the blood and cause problems. People who have diabetes need to urinate frequently, get very thirsty and feel very tired. They may also lose weight, are more prone to infections, and cuts and wounds take longer to heal. In type 1 diabetes, the body's immune system, which normally fights infection, destroys the cells in the pancreas that make insulin. As a result, the pancreas stops making insulin. Without insulin, glucose cannot get into cells and blood glucose rises above normal. People with type 1 diabetes need to take insulin every day to stay alive. In type 2 diabetes, the body does not make enough insulin or does not use insulin well. Too much glucose then stays in the blood and not enough reaches the cells. Type 1 diabetes typically occurs in children and young adults, although it can appear at any age. Having a parent or sibling with the disease may increase the chance of developing type 1 diabetes. Type 2 diabetes can develop at any age, even during childhood. However, it occurs most often in middle-aged and older people. A person is more likely to develop type 2 diabetes if they are aged 45 or older. Type 1 diabetes is thought to be caused by genes and factors in the environment, such as viruses that might trigger the disease. Type 2 diabetes is more likely to be caused by lifestyle. Physical inactivity and health problems such as high blood pressure increase a person's chance of developing type 2 diabetes. A person is also more likely to develop type 2 diabetes if they have a family history of diabetes or are overweight or obese.